Imagine going to your doctor with chronic pain. Or maybe this just sudden, deeply frustrating loss of physical sensation.
Right.
And you finally bring it up, only to be told it's just a normal part of getting older.
Yeah, that happens so often.
Or maybe they suggest a psychological referral and, like, just hand you a pamphlet on lubricants.
Which is incredibly dismissive.
Completely. And for up to 43% of women who experience some form of sexual dysfunction during their lifetime, that kind of dismissal is just a daily reality.
It really is staggering when you look at the sheer numbers. I mean, we are talking about millions of people dealing with decreased libido, extreme difficulty with arousal, severe pain during intercourse, or even, the sudden inability to orgasm.
Yeah, a massive portion of the population.
Exactly. Yet because of the profound stigma surrounding female sexual health, it remains vastly underreported. People just suffer in silence.
But today, we are throwing that stigma right out the window. We're looking at a stack of sources that completely change the narrative.
Oh, absolutely.
We have clinical systematic reviews evaluating female sexual health, including one massive review of 17 different clinical studies.
It's a gold mine of data.
It is. We're also looking at 2026 FDA regulatory status reports on cellular therapies, alongside actual medical clinic data that breaks down the costs, the procedures, and the patient experience.
It's a really comprehensive cross-section. It gives us the clinical reality of what works, the financial reality of what it actually costs, and crucially, the strict regulatory guardrails currently in place.
Right. And the mission for this deep dive is to answer one crucial question for you. What is the exact difference between the popular O-shot, which uses PRP, and the highly buzzed about female intimate exosome therapy?
Yeah, that's the big debate right now.
Okay, let's unpack this. We want to give you a clear, no-nonsense roadmap of these regenerative options. So let's start with current gold standard, the O-shot.
Let's do it.
I see this advertised everywhere, from high-end med spas to routine gynecologist offices. But the sources keep referring to it as PRP.
Yeah.
What is actually happening here? Are they, like, just injecting blood?
Not exactly, though it does start with blood. The O-shot relies on PRP, which stands for platelet-rich plasma.
Okay.
The defining characteristic of PRP is that it is an autologous treatment. That's just a medical term, meaning the therapeutic material comes entirely from your own body.
Got it.
You aren't introducing a synthetic drug or some foreign chemical.
Okay, I like the sound of that. It inherently feels safer if it's just my own biology. But I'm trying to visualize this in the clinic. If I walk in for this procedure, how are they getting from a regular blood draw to a localized treatment?
It happens right there in the examination room, and it's surprisingly quick. First, the physician does a standard blood draw.
Just a normal needle.
Yeah, usually just 1 or 2 small vials, similar to what you'd give during a routine physical. That vial is immediately placed into a centrifuge.
Right, the machine that spins really fast.
Exactly. It spins the blood at high speeds for about 10 minutes. The centrifugal force is crucial because whole blood is made up of different components of varying weights.
Oh, so it separates them.
Precisely. The heavy red blood cells sink to the bottom, and we don't want those in the tissue because they can cause unnecessary inflammation.
Makes sense.
What we want is the golden, straw-colored liquid that rises to the top. That's the plasma. And the spinning process concentrates the blood's platelets right into that plasma.
So you're isolating the platelets.
Right.
And from there, the clinic data says the doctor applies a specially formulated heavy-duty numbing cream to the treatment area.
Yes. The goal is to make the procedure as comfortable as possible.
Because it sounds painful.
Well, once the area is completely numb, that concentrated platelet serum is injected using a very fine needle into the clitoris and the upper vaginal wall.
Wow.
Yeah, this is the area often referred to as the O-spot, which is basically the structural center for the female sexual response.
Let me stop you right there, because injecting anything into that area sounds incredibly daunting.
It does.
But the clinical sources note that because of the numbing protocol, patients actually report very minimal discomfort.
Yeah, that's what the clinical feedback shows.
And in terms of cost, the clinic data shows this runs between $1,500 to $2,000 a session.
That is the standard market rate right now, yes.
And it isn't a permanent fix, right? Like, the data says the physical benefits can last up to 3 years, but the average woman is returning to the clinic for a repeat procedure roughly every 18 months.
That's accurate.
So here is my main question. I understand taking the blood, spitting it, and injecting it, but why does moving my own blood components from my arm to my vaginal tissue actually reverse sexual dysfunction?
To understand that, we have to look at what platelets actually do. Most people think of platelets simply as, the things that make your blood clot when you get a paper cut.
Right. Scabs.
Exactly. But they are actually the body's primary first responders for tissue repair. When they're concentrated and injected into the vaginal mucosa, they undergo a process called degranulation.
Degranulation. That sounds like they're dissolving.
Think of it more like they are popping open.
Oh, okay.
When they pop open, they release a massive payload of growth factors into the local tissue. Now, the scientific literature is full of complex names for these.
I bet.
Yeah, like vascular endothelial growth factors, platelet-derived growth factors. But what you really need to know is the instructions these factors give to the surrounding tissue.
Instructions.
Yeah, they act like chemical flares, signaling the body to start 3 vital repair processes.
Okay, what is the first process?
First is angiogenesis, which literally means the creation of brand new blood vessels.
Oh, wow.
Yeah, in cases of decreased libido or lack of arousal, poor blood flow is very often the culprit. By growing new blood vessels, you are restoring blood flow, which immediately increases sensitivity and natural lubrication.
That makes total sense. If the plumbing is better, the function returns. What's the second?
The second process is collagen synthesis.
Like foreskin.
Exactly the same concept. Over time, or say after childbirth, the vaginal walls can lose their elasticity and structural integrity.
Right.
The growth factors tell the local cells to start churning out fresh collagen, which thickens and strengthens the tissue.
Okay, and the third?
The third process is perhaps the most critical for sexual dysfunction, and that's neuroregeneration.
What you mean, repairing actual nerve damage?
Yes. The growth factors stimulate the repair and growth of the microscopic nerve endings that are responsible for transmitting pleasure signals.
Wow. Okay, so when you combine new blood flow, thicker tissue, and repaired nerve endings, the clinical results start to make a lot of sense.
They really do.
Because this systematic review of 17 different studies we have on our stack shows some incredible numbers. I mean, they saw improvements in vaginal lubrication ranging from 20 to 60% above the patient's baseline.
And the data on orgasmic function is even more compelling.
Really?
Yeah, the clinical indexes recorded up to a 70% increase in orgasmic function scores.
70%.
Yes. For a patient who has been suffering from a complete inability to orgasm, a 70% improvement is a life-altering outcome.
Absolutely.
The studies also highlight a significant reduction in what the medical field calls dyspareunia, which is severe pain during intercourse.
Okay, I am trying to wrap my head around the mechanism here. So PRP is basically like sending a general repair kit to a construction site.
Right.
Like you aren't bringing in outside contractors. You are just taking the body's own natural repair materials, packing them into a highly concentrated box, and dropping them exactly where the building is starting to degrade.
I think that's a very helpful way to visualize it. You're taking the scattered raw materials of healing, consolidating them, and forcefully signaling the local environment to start construction immediately.
Yeah.
And because it's your own material, the risk of an allergic reaction or immune rejection is virtually non-existent.
But reading through the clinic guidelines, it seems that exact strength, using your own biology, is also PRP's biggest limitation.
How so?
Because if this whole process relies on the vitality of my own blood, well, what happens if I'm 60 years old?
Ah, yes.
Like if a patient is dealing with menopause or chronic inflammation, aren't their own platelets naturally less active? Doesn't that mean their repair kit is missing some tools?
What's fascinating here is that you've hit on the exact biological ceiling of PRP.
Okay.
The biological age of the patient directly dictates the regenerative response. A healthy 25-year-old's platelets are naturally going to possess a much more robust, aggressive growth factor profile than a 60-year-old's platelets.
So an older patient might spend $2,000, go through the procedure, and just not see that 70% improvement because their own cells are essentially a bit sluggish.
Yes, exactly. They might require multiple sessions to achieve even a fraction of the result, or their biology might just tap out.
That's frustrating.
It is. They simply can't push the regeneration any further using their own aged cells. But this is exactly where biotechnology has stepped in.
Wait.
Science has spent the last decade figuring out how to bypass the aging of the patient's own cells entirely. And that brings us to the core comparison of our deep dive.
The shift from PRP to exosomes.
Exactly.
Exosomes. If you look at the 2026 aesthetics and regenerative medicine market, this is the ultimate buzzword.
Oh, it's everywhere.
Every high-end clinic is talking about them, but the sources describe them very differently from PRP. So, help me out here. If PRP is just my own concentrated blood, what on earth is an exosome?
To understand exosomes, we have to look at how cells communicate. And first and foremost, exosomes are not cells.
Wait, back up, stop right there. If they aren't cells, how are they doing anything inside the body? Are they a synthetic drug?
Neither. They are naturally occurring extracellular vesicles.
Still too technical.
Fair enough. Think of them as microscopic bubbles or highly secure envelopes that are secreted by stem cells.
Okay.
In clinical applications today, these are usually ethically sourced from umbilical cord mesenchymal stem cells, or MSCs.
Wow, okay.
Yeah, these stem cells are essentially day zero cells. They are as young and vibrant as human biology gets.
Okay, so the stem cell creates this little envelope. What is inside it?
That is the magic. Inside these microscopic envelopes is a highly concentrated, incredibly potent cargo.
Like what?
They carry specific proteins, lipids, and crucially genetic material like messenger RNA or mRNA.
Oh, so they are literally the messengers.
Precisely. When an exosome is injected into tissue, it travels to a target cell, let's say an aging cell in the vaginal wall.
Okay.
Because the exosome is just a tiny lipid bubble, it easily fuses with the outer membrane of that older cell. Once it fuses, it drops off its cargo of mRNA. That genetic material fundamentally alters the behavior of the older cell.
So going back to our construction site analogy,
Right.
if PRP is me moving my own potentially older bricks around the site to try and patch a hole, what is an exosome?
If PRP is relying on the materials you already have, an exosome is like a team of highly trained specialist architects parachuting onto the site.
Okay, I like that.
They don't bring bricks. They bring flawless, day zero blueprints. They walk up to your older, sluggish construction workers, hand them the blueprints, and essentially say, this is exactly how you operated when you were 20 years old. Start building.
That is wild. They are providing the genetic instructions for rejuvenation rather than just the raw materials.
Exactly.
And the sources point out a staggering difference in potency. Exosomes can contain 10 to 100 times the concentration of growth factors compared to a standard PRP draw.
It's a massive upgrade.
Plus, because they're just tiny decicles, they're a fraction of the size of a platelet.
That size difference is crucial. Because they are so microscopic, they penetrate deep into the surrounding tissues far more effectively than larger platelets ever could. They don't get stuck, they diffuse rapidly.
Let's talk about the logistics of this in the clinic, because the patient experience is radically different, too. There is no blood draw with exosomes, right?
Correct. For patients who have a phobia of needles or who become faint at the sight of their own blood being spun in a machine, this is a massive advantage.
Huge.
Exosome therapy comes pre-packaged in a highly standardized vial sent directly from a laboratory. The physician simply thaws the vial, and it is ready to be injected.
And the clinical sources highlight that the recovery time is different.
Yes.
With PRP, the mechanism involves creating a localized, mild inflammatory response to signal the body to heal. That means a patient might have a few days of swelling or soreness.
Yeah.
But exosomes don't work like that.
No, because exosomes bypass the inflammatory trigger completely. Remember, they are fusing directly with the cells and dropping off instructions.
Right.
The signal speed is incredibly fast. There is virtually no lag time, meaning the downtime and soreness associated with the inflammatory phase of PRP are dramatically reduced.
That sounds amazing.
It is, but as you might expect, this level of biotechnology comes with a heavier price tag.
Right. The clinic data shows an exosome session generally runs between $1,500 and $4,000.
Yeah.
So it can easily be double the cost of the O-shot.
Yes. You are paying for the meticulous cultivation, isolation, and purification of these vesicles in advanced laboratories.
Here's where it gets really interesting.
Yeah.
I am looking at this entirely logically based on everything you just explained.
Okay.
If exosomes are up to 100 times more potent than PRP, if they act faster, if they skip the painful blood draw, and if they provide a standardized, youthful blueprint regardless of how old the patient is.
Yeah.
Why on earth isn't everyone just doing exosome therapy? What is the catch?
The catch is regulatory, and it is a massive, incredibly complicated hurdle. We have to look at the 2026 FDA status report included in our sources.
I can lay it on me.
The demand is undeniable. Consumer search interest in exosomes has surged 557%. The global exosome market has reached a staggering valuation of $58.1 billion.
$58 billion, with a B.
Yes, but here is the reality check. Despite a $58 billion market, there are currently 0 FDA-approved exosome products for any therapeutic use in humans.
Wait, I must have misheard that. How does a medical treatment generate a multi-billion-dollar market globally and surge in popularity with literally zero FDA approvals?
It is the ultimate regulatory paradox of modern medicine. To understand why this is happening, you have to look at how the FDA classifies biological products, specifically through the lens of manipulation.
Manipulation of the cells.
Yes, when a doctor performs a PRP treatment, they are drawing your blood, spinning it, and putting it right back into you in the same procedure. The FDA considers that minimal manipulation.
Because it's just my own stuff.
Exactly. It's your tissue doing exactly what your tissue normally does, just in a different spot.
So spinning my blood is fine, but growing something in a lab triggers a whole different set of alarms at the FDA.
Exactly. Creating exosomes requires taking stem cells, putting them in a bioreactor in a lab, expanding their numbers, isolating the vesicles they secrete, and purifying them into a vial.
That's a lot of steps.
And the FDA classifies that entire process as more than minimal manipulation. Because the cells are expanding outside the body, their fundamental biological characteristics could theoretically change.
Which means it isn't treated like a simple blood transfer anymore.
Right. It falls under the jurisdiction of the Center for Biologics Evaluation and Research, or CBER. They regulate exosomes exactly like a brand new pharmaceutical drug.
Oh, wow.
Yeah, to get an FDA approval for an exosome product, a manufacturer must go through a grueling 8 to 12-year clinical trial process. They have to rigorously prove safety, purity, and potency across phase 1, phase 2, and phase 3 trials.
So the FDA isn't saying exosomes are fake science.
Not at all.
They're saying the burden of proof for manufacturing a biological product is incredibly high. And because the science is so new, no company has managed to cross the finish line of a 12-year trial yet.
That is the exact situation. The science is moving faster than the regulatory framework can process it. And this massive gap between the undeniable scientific potential of exosomes and the agonizingly slow FDA approval process has created a highly dangerous gray market.
Let's dig into that gray market because the sources we have are very blunt about the risks.
They are.
Since patient demand is through the roof and people are desperate for these regenerative benefits, you have shady clinics and non-compliant manufacturers stepping in to fill the void. They are selling unapproved exosome products, making wild medical claims, and putting patients in real physical danger.
The dangers cannot be overstated. The FDA has issued multiple severe warning letters to manufacturers for failing to validate their sterility procedures. Think about it. You are injecting a biological soup derived from another human's cells directly into your tissue. If that vial isn't perfectly sterile, the results are catastrophic. The CDC and the FDA have documented severe bacterial infections, life-threatening allergic reactions, and most terrifyingly, tumor formation resulting from unapproved exosome products.
Hold on. Tumor formation. That escalated quickly. Why would an exosome cause a tumor?
It comes back to the cellular signaling we discussed earlier. Exosomes carry powerful genetic instructions that say grow, multiply, and repair.
Right?
That is wonderful if they are targeting a sluggish cell in the vaginal wall. But if a shady manufacturer fails to purify the batch, or if the stem cells used were unstable, those exosomes might fuse with the wrong kind of cell.
Like a mutated cell.
Perhaps a cell with a microscopic pre-existing mutation, exactly. If you hand a mutated cell a blueprint that screams multiply rapidly, you have just instructed the body to grow a tumor. This is exactly why the FDA demands a 12-year trial to prove that these products are pure and safe.
Wow. Okay, that completely reframes the $58 billion gold rush.
It definitely changes the perspective.
So if someone is listening to this right now, and they are struggling with severe dysfunction and desperately want the potency of exosomes, are they just out of luck? Is there any safe, legal way to get this treatment in the United States in 2026?
Yes, there is. But there is only one legal pathway. The only compliant way to receive exosome therapy right now is through an FDA-authorized investigational new drug, or IND, clinical trial.
So you have to actually enroll as a patient in a scientific study.
Right. Companies like Eagle Therapeutics or eVast Bio have submitted mountains of manufacturing data to the FDA to prove their exosomes are sterile, stable, and ethically sourced.
Okay.
Based on that data, the FDA grants them permission to conduct official clinical trials. Patients can find these trials and enroll. That's the only way to ensure you are receiving a highly regulated, pure product while being closely monitored by medical professionals.
Okay, let me bring this all together. If you're listening to this, you're looking at a very clear fork in the road.
Right.
On one side, you have the O shot, which uses your own PRP. It is autologous. It is fully compliant, widely available, and carries a very low risk because it is your own tissue. It works incredibly well for a lot of women.
Absolutely.
On the other side, you have exosome therapy. Scientifically, it is a powerhouse. It is the undeniable future of medicine, but it carries significant regulatory and safety unknowns. If you get it from a strip mall med spa making promises they can't keep, you're playing Russian roulette with your health. You have to find an official IND trial.
That perfectly summarizes the reality of the landscape.
So let's bring this down to the practical, individual level. We've laid out the deep science, the thousands of dollars it costs, and the scary regulations.
Yeah.
If a patient is sitting in a consultation room with their doctor tomorrow, how should they actually structure this decision? How do you choose between PRP and exosomes?
Based on the clinical guidelines established in our sources, the decision tree usually hinges on two primary factors: the patient's age and the severity of their symptoms.
Let's start with age.
If a patient is under 35, or if they are just looking for preventative maintenance.
Like maybe they've noticed a slight decrease in natural lubrication or mild discomfort.
Exactly. Their own PRP is highly potent. It is cost-effective, extremely safe, and will likely yield fantastic results because their biology is still very active. The repair kit is fully stocked.
And if they're older,
If the patient is over 50, or if they're dealing with severe chronic dysfunction, perhaps brought on by menopause or a medical condition where their own stem cells are depleted, the standardized extreme potency of exosomes becomes much more appealing.
because they need that boost.
Yeah, the ability to introduce that day zero blueprint can overcome the limitations of their own aging cells. But again, the doctor must guide them toward a legal, compliant IND trial pathway.
And the second factor is procedure comfort, which we touched on earlier, but it's a huge psychological hurdle for some people.
Absolutely. PRP requires a blood draw. It requires sitting in a chair and watching your own blood being spun in a machine.
Which is a lot for some folks.
For individuals with a severe phobia of needles or blood, that anxiety can completely outweigh the benefits of the treatment. For those patients, enrolling in a trial for a prepackaged exosome vial might be preferable simply because it removes the blood draw from the equation entirely.
If we connect this to the bigger picture,
Yeah.
what we're really talking about is a fundamental transition in the history of human medicine.
I agree completely. For centuries, medicine has been entirely focused on treating symptoms. You experience pain, we give you a pill to block the pain receptor.
Right.
You lack natural lubrication, we give you a synthetic lubricant to use in the moment. But with cellular therapies, both PRP and exosomes, we are abandoning symptom management. We are literally communicating with human tissue at a molecular level.
It's mind-blowing.
It is. We are speaking the language of your cells and instructing them to physically rebuild themselves.
It's a profound shift. We are moving from managing decay to actively commanding regeneration.
Beautifully said.
To recap our deep dive today, we unpacked the exact differences between your regenerative options. We looked at the O-shot and PRP, the well-established autologous treatment that safely utilizes your own biology.
Right.
It has a proven track record of bringing significant physical relief and joy back to women's lives. Then we explored exosomes, the ultra-potent, lightning-fast cellular messengers. They represent the absolute bleeding edge of biotechnology, but they are currently navigating a strict zero-approval FDA landscape, meaning you have to be incredibly careful to avoid the dangerous gray market and seek out legal clinical trials.
Exactly.
So what does this all mean? It means you are now armed with the exact knowledge you need. You know the underlying science of how these therapies work. You know the financial costs.
And the risks.
Most importantly, yes. You know how to spot the red flags of a shady clinic, and you are fully prepared to have a highly informed, serious conversation with your doctor about your regenerative health. You do not have to be a part of that 43% suffering in silence.
The scientific options are very real, and the biotechnology is accelerating every single day.
And speaking of accelerating science, I want to leave you with one final provocative thought that was briefly mentioned at the very end of our clinical sources. It's a concept called hybrid therapies.
Oh, this is fascinating.
Right. Think about this. As clinics navigate these complex regulations and move beyond 2026, researchers are starting to look at combining these tools. What happens when you combine the physical structural scaffold provided by the concentrated platelets in your own PRP with the high-speed genetic signaling boost of exosomes?
It's the best of both worlds.
Will the future of medicine no longer be about choosing the best single treatment, but rather about perfectly sequencing multiple biological tools into a customized multi-stage cocktail. A cocktail that completely re-engineers how human tissue ages.
It could change everything.
When that day comes, maybe that 43% statistic won't just drop. Maybe you'll disappear completely.